Hi, I'm Dr. Jamie Grifo. I'm at the NYU Langone Prelude Fertility Center at the NYU Medical Center, and I'm in New York City. So what makes me unique? Well, one aspect of me being unique is I've been a patient. So I've gone through 5 failed IVF cycles, so I know way too much about the specialty. But I'm also trained as a scientist and did extra training, did a PhD, and am very science-based and technology-based. And so it's kind of a marriage between meeting the needs of patients, making you feel comfortable, helping you understand why things are working or not working and what we can do about it, and understanding the science behind it, and then using that science to do it more safely, more effectively, with less bad outcomes like miscarriages. So it's looking at the whole patient, the whole picture, but then using the science and the technology and continuing to improve the technology. We've spent our whole careers here trying to get better at what we do. We come to work every day, and that's our goal, is to get better so we can have better outcomes for our patients and better experience for our patients. Advice. It is really tough. It is a challenge that you're not prepared for. There's nothing that prepares you to be going through fertility treatment. And so you have to understand the science, because if you understand the science, then you understand why this month didn't work, and you don't get so discouraged and feel hopeless. You need to feel hope, because odds are in your favor, but the secret sauce to success is not giving up. And there are moments when you're going to feel like you're going to give up and you want to give up. And there's moments of being discouraged. And there's moments where you just feel really bad and you blame yourself for things that aren't your fault. This biologic system wasn't designed for what we're doing. We fight odds. It is a numbers game. And the more times you are in the game, the better the chance you're going to win the game. So you got to stay in it. Sometimes you got to take breaks. You got to give good self-care. You got to manage your stresses. If you're feeling bad, you got to do something about it, not let it take over your life and take you over. So that's really important if you want to get through this in the best way possible. So the best part of my job is, and I've been doing this a long time, is now meeting these children who I've helped come into this world. Our team has helped come into this world, and seeing the impact that it's made, not just on our patient, but their whole family. And also this amazing human being who, now that some of them are over 30 years old, and meeting them. And one example happened to me just this year. One of our residents showed up on first day of service with a picture of on her phone of the 2 embryos I put in her mother back in 1992. And she was asking me which one was her and which one was her twin sister. Now, what's remarkable about that is, one, I couldn't tell. And it didn't matter, because they're both amazing kids. I've met both of them. But she is going to be a superstar in our field. She is like soaking this stuff up. She's going to go into this field. She's going to be an amazing researcher, an amazing doctor. And I get the privilege of, one, helping her come into the world. And then I get this amazing, great, boomerang of actually seeing the product of her parents' labors and our help. And now I'm going to contribute to our field in another way, knowing that when I'm gone, I'm going to have somebody like her being better than me, because I know she will be.